Hi everyone, Amber Canoy here with Everyday Kentucky. As you might know, November is National Hospice and Palliative Care Month, and Euretha Godby with Hospice of Lake Cumberland is with us once again. Last time we talked a lot about the hospice side of things, really that it's designed to let people live to the absolute fullest the time they've been given. So making a call to hospice when you're given a very kind of like terminal, definite time period for life is to your benefit, to your family's benefit, to maximize the time you have left. It's not giving up. We want people to know that. But what's the palliative side of care that you all offer?
Palliative care is a little bit different. You have to have been diagnosed with a illness that is creating symptoms and problems that you just need some special extra care. And so the physician will give, most of the time, the physician or family will give us a call and say, my loved one is dealing with this, and we're really struggling with keeping them in good symptom control. They may be still receiving chemotherapies. Our nurse practitioners go out to the home and they evaluate what do we need to get on board so that while we're taking these curative treatments, we need to make sure that you're feeling as well as you can. A lot of the physicians really like that aspect because we can help them while they're not having to go in and out of their offices as often.
So give me an example of maybe a diagnosis that would maybe warrant palliative care.
A metastatic cancer, maybe a breast cancer or lung. We also see some end-stage dementia patients in our palliative program. Heart disease.
I've actually heard a lot of kids utilize this as well. Like, I mean, kids can have some serious illnesses, and this is when palliative care might be, called in because the parents are just kind of like, I don't know what to do.
Yeah, and that gives them someone to call. Our nurse practitioners are on call 24/7. They can give them a call if something comes up and maybe the child is having a different symptom or the treatments are affecting them some different way. Then they can get the specialized symptom control that they need.
I know last time we mentioned that you all are always looking for volunteers. How if someone, if they saw what we talked about last time with hospice, or they're seeing this, wants to volunteer, but they're just like, I just don't know how or what that would look like.
Right. Well, the first thing they can do is just call our office, go on our website, like you said. We love our volunteers. I can't say that enough. I work closely still with a volunteer that has been with us. We celebrated 29 years this year. And so she will tell you she's done a little bit of everything. Our volunteers do our office work. They come into the office and do lots of things. They also go to the homes, and they're special to our families because they can do errands. They can run to the grocery. They can stay with the patient while they're gone. They can read or play, games with the patient while the caregiver is out doing what they need to do. It's just amazing to see that connection. We also work with a lot of volunteers that are veterans.
Yeah.
We honor veterans program, and the veterans program has been amazing for those patients in palliative and in hospice that have special needs because of their service. And so it's very helpful. Volunteers make up a tremendous amount of our program.
So it's a way for people in the community to just love back on people in whatever way they need.
Right, absolutely.
All right, again, I wish we could continue this. Best way to get more information is go on and check their website out or give them a call.